At 6:46, 500 people a month with mental health problems are being sent more than 30 miles from their home for treatment.
An independent inquiry chaired by Lord Crisp, a former chief executive of the NHS, says the practice is unacceptable and potentially dangerous.
Gloria Nuttall was 17 when she was diagnosed with schizoaffective disorder. She's now a mental health campaigner, makes videos about her condition as well. She joins us this morning. Very good morning to you, Laura. First of all, just tell us a little bit about your condition and the kind of treatment you have to have.
Well, my primary diagnosis is schizoaffective disorder, which it has elements of sort of schizophrenia illnesses, so I can suffer from psychosis, delusions, hallucinations, and there are also elements of a mood disorder. For me, it's depression, so I can go through periods of very severe depression.
Okay, so this is a serious condition, and it requires you to seek treatment sort of periodically. How often do you have to go for treatment, and how does the logistics work out for you?
Well, I sort of have ongoing care from a psychiatrist and a community psychiatric nurse, and other than that, I don't usually need to access other treatment. However, if I do become very unwell, like I did recently back in November, then I will need to possibly access inpatient treatment or from care from a crisis team.
And you have had to travel some distance for some of this treatment, haven't you? What have you had to do?
Back in November, when I was unwell, I had to travel to Manchester to stay in hospital.
From where?
From Lincolnshire.
Right.
Yeah, so it was a fair distance.
And how much difference does that make to your recovery and trying to deal with what you have?
It does make a difference because I, for one, find that family support is a massive, massive factor when it comes to recovering from mental illness and relapses. So being that much further away makes it harder for you to see your family. It also just adds to that fear factor that is involved when it comes to being admitted, because it is scary, especially when you're unwell.
Do you mean just being further away from home?
Yeah, because just simple things like seeing your family or your family attending important meetings with the doctors, it all becomes much more complicated.
What does your experience, because I know you write and you share videos about this, have people shared with you that fear, and does it deter them from seeking help?
Yeah, some people have told me that it does, especially if they're at the point where inpatient treatment is being discussed but isn't they're not going to be sectioned if they refuse. I think the fact that they might have to travel so far could put them off seeking that inpatient treatment, and it could get to the point where the choice is taken away from them.
Lord Crisp said that this practice is unacceptable, potentially dangerous. Would you agree with the fact that it is actually potentially dangerous for people as well, in your position?
Potentially, yeah, because if people are putting off receiving inpatient treatment that they might need, then you know, the possibilities are quite dangerous. Mental illness can kill people, yeah.
Laura, thank you for coming for us today.
Thank you for having me.
Thank you so much. Good morning. First, our main story. Thousands of mental health patients every year are being sent for treatment miles from their homes and families because local hospitals don't have the facilities to deal with them.
That's one of the findings of a new independent review into NHS mental health provisions in England. One former NHS boss is labelling the practice unacceptable and potentially dangerous, as our social affairs correspondent Michael Buchanan has been finding out.
Children are some of the most vulnerable within our society.
This is Laura Nuttall, a mental health vlogger. She talks openly about her schizophrenia and depression on her YouTube channel and on an award-winning blog. When the 25-year-old became ill last year and needed hospital admission, there were no beds near her home in Lincolnshire. Therefore, she was sent to a psychiatric unit in Manchester, more than 100 miles away.
It made the whole process of being admitted much, much more scary for everyone. Luckily, the hospital I went to in Manchester was amazing, and I received great care. But it just made what was already a very, very difficult situation and time in my life a lot more difficult.
An increasing number of severely ill psychiatric patients are having to travel sometimes hundreds of miles to get essential care. Today's report says the practice should end within 18 months, as it leaves patients isolated and delays recovery.
Too many people are taken too far to receive treatment. They're not able to get their non-specialist treatment, which should be provided locally. They're not able to get it locally. And every month, something like 500 people are travelling over 30 miles.
The problem is that for decades the NHS has closed beds, but admissions have remained constant. Access to acute psychiatric care for adults is inadequate, concludes today's report, and potentially dangerous in some cases. Ministers say they've already told NHS England to eliminate the inappropriate use of out-of-area placements, and that they'll work on the other recommendations in the coming months. Michael Buchanan, BBC News.